Yes. So, welcome everybody to my presentation. It's about how we can make an adaptive network model to simulate the effects of AI coach to support safety in hospitals by allowing better adherence to guidelines in medical protocols. And in the context of this presentation, we'll be focusing on the neonatal medical protocols of um, hypoglycemia prevention and the prevention of jaundice. So, um, around the world, healthcare services are provided in healthcare centers by doctors who are healthcare practitioners, and they work on an established guideline and protocols, which they learn through years of training. However, no matter how much experience individuals have, and no matter uh, how many times individuals learn the theory, human nature is it's inevitable to make a mistake. And sometimes this happens in the hospital as well, where healthcare practitioners can make mistakes while following a neonatal medical protocol that they already know about. And this can affect healthcare. It can make healthcare suboptimal, and it can even sometimes compromise patient safety. And so that's why it's important that we find a solution where this problem can be prevented and we can adhere to these guidelines as more accurately as possible. And this is where AI can jump in to help, because AI is, well, in real life, AI is a computer program, and it allows for a perfect memory and something, because it's computerized, it can repeat the same program without fail. So in this thesis, we focused on the neonatal medical protocols to prevent hypoglycemia and hyperbilirubinemia, which is also known as jaundice. And we showed how an AI coach can come in to uh, prevent any deviations from occurring. And if a deviation occurs, that it can quickly be corrected. So what is neonatal hypoglycemia? Neonatal hypoglycemia is the condition where we have an abnormally low level of blood glucose. And this occurs mainly in neonates, which are newborns. And there are certain risk factors associated that increase the chances of getting hypoglycemia. The implications of hypoglycemia in neonates is that it substantially increases their chance of developing disorders with the brain, because glucose is essential fuel to the brain. And if a body is deprived of glucose, several brain disorders can develop, including connecticus. So there are some challenges with this, which are that hypoglycemia many a times doesn't have symptoms; it's asymptomatic, and um, there's the doctor needs to be very vigilant uh, of making sure that he sees these risk factors beforehand to treat on a timely manner. And to prevent neonatal hypoglycemia from developing into a severe case, intervention is required, and this is mainly in the form of um, intravenous injection of glucose to the body. This can be in high levels, normal levels, or it can also be a bolus dose where we inject glucose, the whole dose in one go instead of spreading it um, in a long time. So then we have neonatal hyperbilirubinemia, which is also known as jaundice, and this is the this is a condition where uh, a neonate develops an abnormally high levels of bilirubin in the blood plasma. Bilirubin is a product of the breakdown of heme, and heme is, for example, is a compound in the body which is attached to the blood, and it's a normal metabolic process, and it should be excreted from the body in a normal world, in an ideal situation. But sometimes this does not happen if, for example, the neonate has a few risk factors such as a high gestational weight or low gestational age, and if the neonate has incompatibility with the mother's blood type and liver problems. And when this happens, the bilirubin reaches to a high level, and because it's yellow, it causes the skin to become yellow. That's one of the most striking symptoms of hyperbilirubinemia. And to treat this, we doctors use phototherapy, which is a therapy where they expose the baby's body to a certain wavelength of light, typically between 400 to 480 nanometers of wavelength. And the light breaks down the bilirubin in the blood plasma, which allows it to be better processed by the body and excreted by the body. In some cases, when it's very severe, you have exchange transfusion when you just exchange the blood from of the baby with healthy blood, which does not have a high level of bilirubin. Oh, and if it's not treated, again, the bilirubin can cause brain damage and disorder, and also lead to a condition known as Corneticus, where your brain function is diminished. So in this thesis, we simulated three scenarios, namely ones where there was a perfect mental model for the doctor or the healthcare practitioner. And the second scenario was an imperfect mental model of the doctor. And the third was also an imperfect mental model of the doctor, but when the AI coach intervened to correct. So we work with an approach known as a network-oriented self-modeling approach to model these simulations, and adaptive and so a network-oriented approach is just when you use dates and links to model a complex process which can be modeled in time, and then it's known as a temporal causal process because the links between states and another state have a causal effect on each other. However, if you would like to control control these causalities between states, you can use self-models or adaptations to control certain characteristics, such as the strength of these links or the speed that the speed of the effects that these causalities have. And this is called the first order self-modeling approach. But this can further be iterated again and again into second order, third order, fourth order. However, mostly it's only in literature you only can get up to second order self-modeling adaptations. And we, in the base network, which is just when you're modeling the process on the base level, we use mental models, which is how a certain individual perceives reality and how it interacts between the real world, what is happening in the real world, between what's happening in their own mental state, and it allows them to predict and prepare to act on stimulus from the real world and effectuate an action back. So we implemented this in the following way. We used some some vulnerabilities in the protocols of both neonatal hypoglycemia and neonatal jaundice or hyperbilirubinemia. And we primarily use these vulnerabilities to model weaknesses in the mental states of the doctors. And we used Hedian learning, which is a principle where you known, which is known as when neurons wire together, they fire together to model the strength of the connection. And then we again used a second order, a characteristic of persistence to control the learning, the learning rate of that these connections had. Because persistence is a factor where, for example, if a persistence is 95%, then by every time unit, you only lose 5% of the information or the learning that you have incorporated in your mental state. And we model this to make sure we know exactly how much learning is taking place and how the defect or the deviations in the medical protocol is affecting how the doctor is what the doctor's forgetting. So the vulnerabilities in neonatal hypoglycemia are misdiagnosis of risk factors because, as I said, we're focusing on asymptomatic cases where the doctor really needs to pay attention and screen the baby beforehand. There could be insufficient monitoring and improper blood sampling. And this would mean that if the doctor doesn't do this in a regular interval, the hypoglycemia could increase again into a severe case. So it needs to be well monitored. Sometimes, when there's an intense case, a severe case of hypoglycemia, you're supposed to give a bolus glucose dose where you inject glucose directly into the bloodstream with a syringe. However, a lot of times this is forgotten, and we just have a high concentrated intravenous dosage in the blood. And there must, of course, also be proper post-treatment surveillance to make sure that the hypoglycemia again doesn't increase. We also have vulnerabilities in neonatal hyperbilirubinemia, where we don't observe a visual tint, a yellow tint in the skin, which can be missed, and so the condition can be diagnosed later, which can already cause danger to the infant. You need to keep breastfeeding the baby to make sure that the baby gets enough carbohydrate nutritional intake, which is important in regulating bilirubin levels. However, a lot of times the baby is separated from maternal care and it doesn't come back, isn't reunited on time. So this needs to happen. Also, phototherapy does have side effects, and it can cause, if it's too intense and it's exposed for too long, it can cause side effects such as irregular sleep and damage to blood vessels in the baby. So after some time, you need to cease phototherapy and not prolong it too much. And of course, transfer the baby back to maternal care and keep the baby under supervision after you discharge the baby to make sure that the bilirubin levels don't increase again. This was the model for the uh, modeling the hypoglycemia. So what we have done here is we have made a common AI model, which has um, both the protocols for hypoglycemia and hyperbilirubinemia prevention in its mental state. And all the and in the middle we have the pink states which are the world states on what is really happening in the real world, and then we
Mhm.
have the mental model of the doctor. So the doctor, their context factors implemented in the world states, depending on what happens with the baby. For example, sometimes the baby can have severe symptoms or sometimes not severe symptoms. So to control that pathway, we modeled all scenarios on the most severe pathway with the most severe symptoms. And so the context factors allowed us to make sure that the other pathways were not interfering with the simulation. And the doctor is monitoring all the information coming from the real world, for example, the measurements and what the risk factors are, what the baby actually has. For example, we have a large gestational age as a risk factor. So a small gestational age, which is another risk factor, can't be the case because that's contradictory. And then the AI model is monitoring all the states to make sure it has all the information in its mental model. While the doctor doesn't need to do that because the doctor already has certain knowledge already predetermined, as he probably learned this protocol before. And the doctor can, once it has something in its mental state, it knows what steps to take next. So then it effectuates taking that action in the real world. So the green arrows are taking the action in the real world, and the red arrows are the upward arrows where the information is going into the mental state in the mental model. And so we have these risk factors here, which are modeled with Hebbian learning. So we have the observed risk factor over here. I can actually use the next slide to give you a better overview of the base level without any interference. So we have observed risk factors, and we have making sure that the glucose dose is given if there's a severe case of hypoglycemia. And we also have the keeping the neonates under supervision over here, which needs to be monitored that it's followed effectively. And these are the W states, which are the states, first order states modeling the connection. And these M states over here are the is representing the persistence of the first order states. So this is really the metaplasticity. And then we have the neonatal hyperbilirubinemia model. We again have making sure that the jaundice is visually observed, that the neonate is transferred to maternal care once phototherapy is stopped. Making sure that phototherapy is stopped on time and it's not prolonged. So if you look here, this is falling phototherapy levels. So if the symptoms are becoming less intense, then you should stop phototherapy. And lastly, we have keeping the neonates under supervision and checking levels of the bilirubinemia on time and frequently to make sure that increases don't happen. We have connections from the AI level to the a base level of the AI mental model to the first order level of the um, the first order states for the mental model of the doctor, because the AI needs to communicate to the doctor, since it cannot take physical actions in the real world. It needs to communicate inside to the mental state of the doctor that if a connection is weak, meaning if a protocol is not being followed ideally with a perfect mental state, then should increase the it should increase the level of um, the strength of the connection, which translates into making the doctor perform that action more accurately and follow it more accurately in the real world, which is then again transferred back, affected back, and resulted back in the real world with the red arrows. So this is the simulation for the first scenario 1 for hypoglycemia. And this basically shows that for the states that in a perfect mental model, when everything is followed correctly, we have certain states that are and at the beginning that increase very um, uh, suddenly, and through the progression of the protocol, the other um, the other actions are performed later. So this is the ideal mental state where there's no mistakes committed by the doctor. But then if we move on to scenario 2, where we do have a mistake committed by the doctor, then you can see that all the first order states which um, are modeling the adaptation of the connection between the states, and then the resulting states, which are the vulnerabilities. They are all performed later. The time here is over 150 time units, which is considerably more than in an ideal world, while other states are modeled before. And that means that some steps are taken before these steps, which are the vulnerabilities, and that translates in the real world in having suboptimal treatment. So these the states that you see that are increased later are the ones that have a lower connection between the base level and the first order state. So they decrease they increase more later, which indicates a deviation when following the protocol. Now, when we in the third scenario, when we have a perfect mental state, mental model of the AI coach interfering in the healthcare protocol of the doctor, what the doctor is following. We see that it rectifies the delay that the doctor caused earlier, and that states increase quite fast in the progression of the treatment, and that there's no delay or deviation in following any specific actions in the treatment guidelines. So we see that the AI coach indeed does interfere and serves its purpose to make sure that the guidelines are well adhered to. So this we move on to again simulation results for the scenario 1 of hyperbilirubinemia prevention, and we again see that there is a significant delay not delay, sorry, this that the guidelines are well adhered to because they increase quite rapidly in the progression of the treatment to quite a high level as well. Some states, such as the neonate being born, are always modeled at one because the neonate is always born. Sorry. Um, and then in the progression of the treatment, the other states also follow in succession rapidly. The other actions are correctly performed by the doctor. So this is again a perfect mental state, perfect mental model that the doctor has, the healthcare practitioner, and he follows the guidelines without committing any mistakes or preventing any delay in uh, in in performing any action. Then when you model uh, the doctor performing the guideline, following the guideline with an imperfect mental model, you see that the doctor does not follow the specifically the vulnerabilities that we have modeled. The doctor does not follow them adequately because the connection is weak between the adaptations. And we can see that the time difference here is greater as well. Here you have the first order states increasing after 100 time units, and the actual world states increasing after 250 time units, while here it's all before 60 time units. So there's a significant delay in deviation and following the guidelines, while other um, other um, states are already performed earlier. So there's a mistake while following the guidelines to prevent neonatal jaundice. So then, if we move further to again having the AI model intervene, AI coach intervene, and use a perfect connection, telling the doctor um, the mental state of the doctor, that mental model of the doctor, that there's a connection is weak, so you're not following the treatment correctly, the treatment guidelines correctly. The doctor comes to know about this mistake, and then he rectifies it in his he realizes it in his mental state that there's some connection which is weak, meaning that there's something that is not being followed adequately, and he again rectifies his mistake. You can see that most of the first order states and the world states are followed in quick succession, and the treatment is conducted in well-ordered steps, one after the other, without any delay here. And these three states that you see, which are taking a long time to increase, a longer time to increase, are actually the persistence in learning, which is modeled in the second order adaptation level. And that means that the doctor is actually increasing his persistence for learning, making sure that the connections won't become weaker in the future. Because if the persistence increases, then we have less forgetfulness every time units of something that was not followed correctly. So again, we see that the AI model correctly intervenes and solves the problem by informing the mental model of the doctor that the treatment was not followed accurately. So in conclusion, we see that with the introduction of the AI coach, while simulating the three scenarios, served its purpose and did inform the mental model of the doctor about mistakes that were made while following the procedure, and then allowed the doctor to rectify the mistake by, in this case, increasing the connection between the world state and the first order adaptation state, which represented the adaptation of the strength of the connection between the vulnerabilities and the rest of the medical protocols. And it did allow at the end the doctor to adhere to the guidelines much better in a more real world scenario where the doctor can make a mistake. And for future research, it would be advised that some experiments related to this could have field trials to actually experiment in the real world if an AI coach could really help inform the doctor about mistakes being committed and allow the doctor to then rectify the mistake, or if it's just more practical in theory or not. And also that we could focus more next time on using a more fuller model, not only modeling the vulnerabilities, but also all the other states, and using organizational learning with a shared mental model to see how the rest of the organization or other doctors who could potentially make this mistake could learn from the mistake of another doctor and sort of potentially prevent making that mistake in the first place. Thank you. That was my presentation.